Retinitis pigmentosa. It is a very diverse clinically and genetically disease which affects the pigment epithelium. Initially, you should know that the initially only rods are affected, but later on it also affects the cones. And what does it does? It usually destroys the rods and cones. So how to define it? It is a diverse type of disease, diverse which is clinically and genetically diverse type of disease affecting the rods and cones. Initially, in initial stage only rods is affected, and later cones are also affected. So uh, actually, and how do they present? Think that the rod are affected means the first symptom and the most clinically significant symptom will be night blindness for those patients. And after night blindness due to rods affected, you can also see in dark adaptation their light threshold is very much increased. Light threshold is increased. Dark adaptation में light threshold is increased in dark adaptation. And the other feature is in late stage of retinitis pigmentosa they present with tubular type of vision. Because of the ring scotoma they can see a tube like vision. Tubular vision is seen. And what are the signs? Regarding sign, you should know that the while fundoscopic examination, फंडस में क्या क्या दिखता है. लोग फंडस में हम आर्टरी देखेंगे, उसके बाद ऑप्टिक डिस्क देखते हैं, और उसके अलावा सम अदर फीचर्स. आर्टरी देखने में क्या दिखेगा? देयर विल बी एटीन्यूएशन ऑफ द आर्टरी, देयर विल बी एटीन्यूएशन, एंड ऑप्टिक डिस्क विल बी pale in color along with some waxy opacity can also be seen. कुछ अदर बॉडीज टाइप के इंक्लूजन बॉडीज टाइप के स्ट्रक्चर दिखते हैं जिसको हम लोग कहते हैं दे आर नोन एज कोलोइडल स्क्लेरोसिस का बॉडीज और कोलोइड बॉडी and the other are sclerosis can also be seen along with sometimes CME. So these were the signs of the fundus. Okay, now coming to the investigation, and under sign you will, when visual field is done, visual field examination is done, visual field shows that there is initially there is a ring type of scotoma, ring or annular scotoma, and later it progresses to the tubular vision. In late stage tubular vision is seen. Now coming to the investigation. Regarding investigation, it is usually done in the clinical investigation. So sign and symptom will help you. And other investigation is ERG, electroretinography. Electroretinogram shows subnormal means जो ग्राफ आना चाहिए वैसा नहीं आता है. और electrooculogram shows absence of the light reflex. Now a very important topic, that is inheritance of the retinitis pigmentosa. Usually you should know that it is usually transmitted with familial history, but about 38% of this is not familial, means not familial. Sporadic disorder से 38%. स्पोरेडिक का मतलब ये हुआ कि there is no familial association, and but remaining the majority portion has familial association, that is inherited disorder, known as inherited disorder, no familial history. ओके, इनहेरिटेड में भी क्या क्या हो सकता है? तो ऑटोजोमल रिसेसिव जो है that is the most common, autosomal recessive, and then it will be autosomal dominant. Most common autosomal recessive, autosomal dominant, or it can be also X-linked inheritance. So this was 38%, and usually this is said to be 25%, and this is 20%. So these were the major inherited supposed hypothesis for the retinitis pigmentosa. Now coming to the treatment modality for the retinitis pigmentosa. What are the treatment? How you can treat? There is no any definitive treatment for retinitis pigmentosa. What we can do, that is only delay the progression. To delay the progression, we can give vasodilators, and some placental extract are also used. Placental extract is used, and the other can be light inclusion therapy, एंड सॉरी लाइट एक्सक्लूजन, मतलब कि लाइट में ज़्यादा ना जाए, एक्सक्लूजन थेरेपी, एंड द अदर इज सुप्रासोनिक थेरेपी एंड acupuncture is also effective. Suprasonic and acupuncture is helpful in retinitis pigmentosa. Now nowadays vitamin A as an antioxidant is also significant and found to be helpful in the retinitis pigmentosa. And some of the other underlying cause like refractive error of the patient should be corrected, and low vision aid should be provided via glass, or rehabilitation should be done. Means other ocular problem अगर है, refractive problem हो चाहे कोई भी हो, then that is also regarded, and there is no definitive treatment नहीं है. तो ये हो गया आपका रेटिनाइटिस पिगमेंटोसा का पोर्शन. Then coming to the some of the other forms of retinitis pigmentosa. Look, the first form is known as retinitis pigmentosa sin pigmento. Sin pigmento का मतलब क्या हुआ कि all the feature are similar to the retinitis pigmentosa, typical form of retinitis जो अभी पढ़े थे, but there will be no pigmentary change. Then that is known as sin pigmento type. There is no pigmentary change. Now coming to the sectorial retinitis pigmentosa. इसके नाम में ही है, because a particular sector or equator quadrant of a retina is only involved, which is showing pigmentary epithelial problem. Sector में ही है कोई एक particular. Pericentric retinitis pigmentosa means what? Pericentric means if the retinal pigment changes are around the macula. मैकुला के अराउंड था, इस ये सेक्टर कोई पार्टिकुलर सेक्टर में है, और सीन पिगमेंटो हैज नो रेटिनल पिगमेंट एपिथेलियल चेंजेस. And what were the retinal pigment epithelial changes? The rods were getting destroyed, and other was you can see colloid bodies, there was a sclerosis in the retina, and you can see other bodies like inclusion bodies type के sclerosis तो दिख रहा था pigment epithelial में, that is known as retinal pigment epithelial changes. And other and last atypical form is puncta albicans, means retinitis puncta albicans. इसका मतलब है व्हाइट डॉट जो है, व्हाइट डॉट इज स्कैटर्ड थ्रू आउट द रेटिना, व्हाइट डॉट्स आर स्कैटर्ड थ्रू आउट द रेटिना, बट देर इज नो रेटिनल पिगमेंट एपिथेलियल चेंजेस. मीन्स पिगमेंट में रेटिनल पिगमेंट में कोई भी एबनॉर्मेलिटी, नो रेटिनल पिगमेंट changes, but there is a white dot scattered throughout the retina. So this is all for the retinitis pigmentosa portion. Thank you.